The following program is furnished by its producer, host, and sponsors.
Good morning, WRCR listeners. This is Mark Brownstein from Emerald Medicare here today, third Friday of each month during this Medicare open enrollment season. Exciting time for those folks who are involved in Medicare, trying to help as many people as possible. We have offices in Stony Point and Nyack. We service really the tri-state area, but we're really licensed in 31 states. We have about 2,000 clients, and we have a wonderful team that does the work throughout the year. And with me today, I have Matt Civitano, a very valued resource and colleague at Emerald Medicare. Welcome, Matt.
Thank you. Thank you so much for having me. Excited to be here. Excited to chat with you today.
It's great to have you here today, and you're such a valuable part of the team. And I love having the various staff members on the radio show, especially this time of the year, because there's so much going on. There's so much activity. I just recently, as you know, Matt, I just recently did a webinar for about 175 people talking about the updates and changes going on in Medicare heading into 2025. And so you're in the trenches with all of us,
for sure,
working hard to make sure that we not only answer the phones, but we also service our clients. So just a little bit about you, Matt, just so that people here have a sense of who you are and where you came from, and so where you live and sort of your career path and a little.
Yeah,
that's
absolutely. So Matt, it's nice to meet everybody. I'm 25 years old and I'm from Hopewell Junction, New York. It's Dutchess County, so it's about an hour from here, Rockland County. I went to college for marketing. I studied marketing. I went to high school in Westchester, so I'm just a New York kid raised in the Hudson Valley. That's me, and I work for Emerald Medicare for the past 2 years now. Just came up on a little bit over 2 years, and I do a lot for the Emerald Medicare team on the back end, and I do admin work, and my work has changed since coming on 2 years ago, but I really do love what we do here, and we have such a passion for what we do.
So again, the skill set that you went to school for and the value that you bring, just to sort of bring it at the beginning part, your skill and your technical skill and the audio work. So just a little bit about that, Matt.
Yeah, right now I'm in grad school, so I work 3 days a week for Emerald Medicare, and the other 2 days are my class days, and I use that time to do schoolwork. So I'm finishing up my grad degree at Berklee College of Music for music production and audio engineering. It's really a deep passion of mine. It's something I started doing when I was in college. One day my roommate, he came home with a microphone to do a project for the basic speech class that he was in. And I had asked him if I could use it and record, myself, doing a cover for GarageBand. And slowly but surely that became, a new passion and something I really found out I could, study professionally, make into a career. And God above opened the door for me to go to Berklee, and I'm learning from some Grammy winners, some people who are absolutely at the top of their field, and I'm just trying to stay locked in, stay diligent. But that's the other days out of the week that I'm not using those marketing skills for Emerald Medicare.
Well, you do what you do with passion.
For sure.
And that's for sure. And you bring great value. And so one of the things that and you've gotten to know well is our team. Mm-hmm. Our team, here in Stony Point, that's where the office that you come to. Mm-hmm. You've gotten to know us pretty well, and you've gotten to know how hard we work and how hard we work for our clients. So,
absolutely.
So just sort of talk a little bit about what you've seen and what kind of work that we do that really is unique in maybe in the world of business or maybe the world of customer service.
Yeah, totally. I mean, the job that I had before Emerald Medicare, I was working for a small business too, and we always used to tell our clients white glove service, and it's something that we did. But I worked for a Verizon store, and we would only work with people for an hour and sell them a phone, and then maybe they'd call back with a question or two. But one of the things we preach at Emerald Medicare is white glove service, and from day one coming onto the job almost 2 years ago, one of the things that was very clear to me right from the beginning was how deeply we care, how deeply the support team cares about making sure that our clients, the people who we help, they have clarity and peace of mind, and that anxiety of am I in the right Medicare plan? Am I going to have my medications now that I'm retired? All that, making sure that worry is eased. We really do care a lot, and that was clear to me from day one. We do a lot of work, especially this time of the year. Our team goes to battle on your behalf. Michelle, Carrie, Diane, Jackie, we all really do a lot of work to make sure that you care.
It is a labor of love, and it is a volume-based business, and so we have a lot of people asking a lot of questions, and that's why I do the webinars, try to educate as many people as possible. And I mean, you've helped with LinkedIn, you've helped with YouTube, you've helped really get the word out, and so technology isn't my specialty. On the other hand, having you around has really given us a chance to get exposure to financial planners, CPAs, case managers, social workers, medical offices, veterans, people who really do need to understand this. And so one of the things we talked about earlier is the importance of a Medicare broker. And people have choice. They see mail in their mailbox. They see different ways in which people are marketing to them. But you seem to have a real good sense and a real feeling that working with a Medicare broker is really what defines the value proposition.
Yeah, I think, number one, first and foremost, like I said, our mission is to give you clarity and peace of mind. And these client professionals, whether it's case managers, financial planners, CPAs, the people who they work with on a day-to-day basis, they're in the trenches with them. And one of the things that they understand is, especially when they're approaching retirement, their clients are rather, is there's so much noise out there. There's so many moving pieces. New legislation comes in each year that, introduces new changes to the Medicare landscape, different, plans for your county, for your state, for your city, all that. And these, client professionals, they understand that you can never do it alone. So that relationship with a broker, it's so important. And what makes it the value and brings the value is, the work that our team does, especially during this time of year, even in the evenings, even in, 7 days a week, on the weekends, we're putting in the work in, really going to battle, making sure that you have the right answers,
Yeah, this particular season that we're in, approaching 2025, has had some major disruption, and I'm calling it chaos. The Inflation Reduction Act has created a tremendous amount of change, specifically in the prescription drug market. Because of the Inflation Reduction Act, the maximum amount of out-of-pocket drug costs that anyone can incur in this country is now set at $2,000. Last year, the maximum was $8,000. The impact on the consumer is incredibly large, though there are some carriers who have raised their premiums on some of their prescription drug plans. And there are some carriers who have raised their formularies on some of the generic drugs, though the total amount of money that a carrier can receive is maximized at $2,000. So because of that, the impact on premiums, on benefits, on Advantage plans, on premiums for the Medigap plans are all being impacted. And so what we're seeing is that people are seeing the news. They're getting notices in the mail. There are some carriers who have actually pulled out of the market or have dropped some of their Med Advantage plans. And so it's creating a tremendous amount of anxiety and concern for people who thought they had a plan that they can stick with for years and now realize that they possibly can't do it alone. To your point, Matt, is that having a broker is important. 80% of the people out there actually, when they go onto Medicare for the first time, actually do it on their own. When they do it a second time, 60% actually use a broker. So we encourage people to use a broker from the beginning so that they get the peace of mind and the confidence that, one, they're in good hands, two, that they know that they can come year after year and work with somebody to get the right answers. So we're certainly see it. And one of the things that you started out in, and others, Diane was on the show last month, and running those doctors and the meds. It might seem like a simple piece, but it isn't, because there's a lot of carriers and a lot of portals, and making sure that we have the spreadsheet so that we can clearly communicate to clients whether doctors are in their network or not. So talk a little bit about that process that you've been involved in with running those doctors and meds.
Definitely. Yeah. Well, to your point, I mean, one of the things to keep in mind as that, out of pocket is decreased, while that might sound cool at first, the carriers are the ones who take the hit. So like Mark said, they have to adjust their costs, whether it's to their formularies, which is the drugs that they cover and how much money they're going to cover on those drugs, or other, the co-pays, all the other expenses that are associated with those plans. They have to raise those to make up for that money that they were banking on. So one of the things that I do and that we do as a team so diligently is when you're on new medications or you've added a medication throughout the year, especially during this time of year as we review your plan, and then if you're even going onto a Medicare plan for the first time, or you're changing your Medicare plan outside of the open enrollment period, we'll take a look at the list of drugs you're on. We'll take a look at the list of doctors that you see regularly, and we'll make sure that the plan that you're on is the lowest cost plan, the most effective plan. If you have a lot of drugs, sometimes there are a lot of options. If you have a lot of doctors you see, sometimes there are varying options. So it's really a process to check and make sure that the coverage that we're offering that you should go on, or recommending rather you should go on, is the best fit plan. So we put a lot of time, energy, and effort into choosing that recommendation for you. We always give you the information, the breakdown of the costs, and if you don't understand something, we hold your hand and help you understand that. But it's an essential part of the process, and it's something that, takes many hands.
It takes many hands, and that's why, I can tell you that most people in this Medicare business are sole independent people, and at some point they have difficulty either dealing with this time of the year, or they have difficulty in increasing their business because they have to service the people that they already have, and it's hard to grow. I am, as you know, continuously marketing. The radio show is one option for me to get the word out, but certainly I do presentations both on webinars and seminars all through the year, probably about 40 of them. I was just at BOCES. I just did a webinar, as I said, for about 175 people. So education to me is what really Medicare is based in. But one thing I want to go back to, and that's the prescription drug piece, and that is that in addition to them lowering the maximum amount of pocket for prescription drugs, they actually have a payment plan put into place, meaning that if you have, for some reason, spending at $2,000 level, if you divide that by 12 months, the cost per month is $166.67. So one can establish a payment plan for the prescription drugs starting this 2025 for the first time ever. And so that is a great opportunity for people to sort of smooth out the payments throughout the year. On the other hand, how it's going to be implemented and how it's going to roll out, I can't say that we are sure yet. All I know is that this is what's being offered. But like you said, Matt, the impact on the carriers and their concern about their profitability and potentially some losses, some bad debt, is really creating a lot of concern in the industry at this time. So again, another thing that you help us with a lot, and I've been so grateful for, is the work around marketing. And so just talk a little bit about some of the things that you've been able to do that has given us great exposure recently.
Definitely. One of the things that I, started doing when I came on was the doctors and drug runs, about 2 years ago for Emerald Medicare. But once the open enrollment period ends and the volume kind of dies back down a little bit less, I was kind of looking around at our team and the daily operations and seeing what the things I could do to lighten their load was for the rest of our support team. Like I said, we have an amazing team. Michelle really is the MVP of our team, and she does a lot on a day-to-day basis. So one of the things that I started doing was talking to her about the things I could take off of her plate. That started with marketing because that's what I studied, in college, and that's what gives me an opportunity to be creative. So I started with marketing, the emails, the digital outreach, all those things that we do regularly, taking over that. And then it slowly but surely turned into, the slides that we do for presentations when Mark goes out and speaks to a group of financial planners or CPAs or our clients or prospects or our local communities, the slides that he uses, connecting with Mark, talking about what he wants to include, what are the topics he wants to talk about, and presenting them in a visually appealing way. really just our branding across the board, uniformity. So then it's turned into the website, making sure that once we got a new website provider, the ease of access for people to, go on there, learn, get educated. We started a blog on the Emerald Medicare webpage, emeraldmedicare.com/blog, where you can learn about some topics that are frequently topics that we talk about with clients. So yeah, it's always an ongoing effort. We're reaching more people. That's the goal. LinkedIn was a big part of that too. We did a really big project on LinkedIn where we reached out to financial planners all across America, giving them 100% free Medicare resources, and offering them our services to talk with their clients and make sure that they're on the right Medicare plans, because it's just something that financial planners deal with on a day-to-day basis. They have clients who are at that retirement age. So that was a really successful campaign that we did, and again, reaching more people, increasing our footprint digitally, and making sure the most people are educated that we can get, whether it's our local communities or across the country. We're passionate about education, clarity, and peace of mind, and there's so much noise. So we just want to make sure that people know and have the right answers.
So it has really transformed our company over the last 2 years, the work that you've been able to help us move forward with, and the branding that we have, the uniqueness that we have as a company, the promises that we make to our clients are also important. Mm-hmm. We do the email marketing and we communicate our webinars and our seminars, and I have another webinar on November 13th, where it's really talking about the updates that are going on for Medicare. Mm-hmm. The changes that I've alluded to around prescription drugs is just one of many areas. There is some good news, though, coming out of changes, and some of that will certainly be discussed. But one of the things on the Advantage plans that are becoming obvious because of the cost pressures is some of these Advantage plans, the benefits are actually going down. So small changes, maybe a little bit of less dental, maybe a little bit of less eyeglass coverage, maybe a little bit less over the counter. So the carriers, not knowing what's going to happen in 2025, have had to sort of figure out ahead of time, without a crystal ball, what they needed to adjust so that they didn't have a lot of loss going into the new calendar year for Medicare. So it's been really quite a challenge for the carriers. I went to a conference in April to learn about the changes. I'm so glad I went, because since I've come back from that conference, I've really continuously focused in on educating people. And again, with your help, I've been able to educate hundreds and marketing this to thousands of people. And so even if people don't attend the webinar, people often either want the recording that mm-hmm. you're able to produce with your musical and technology skills, but also people just know that we're thought leaders. We're not just doing processing applications, and we're educating people. We continue to stay up to date on the changes that are going on in the marketplace. And I think that the social media, as we talked about earlier, that's how people are hearing about things. People, if they looked at our Google reviews, they would see that we have tremendous Google reviews. Mm-hmm. We have Google reviews out of Connecticut, Westchester, New Jersey, Nyack, and Stony Point. So we really have expanded that, and people do that search. Medicare broker, Rockland County, and we want to be able to show up. But we really, once we get a phone call, it's really important for us to sort of find out a little bit about what someone wants and needs, and either some of the staff can handle some of the questions, and in some cases it goes to myself or Jackie, mm-hmm. and we just move things along. So we're pretty proud of what we do, are we not?
Absolutely. Yeah, we are.
We continue to see growth. Yep. We continue to see improvement in our own processes. Mm-hmm. In fact, we have just rolled out a little bit of artificial intelligence that we are testing out, mm-hmm. and seeing if we can get some assistance from that particular technology model on running prescription drugs. And so far, it's going okay, right? Yeah,
definitely. I would say it's going good. One of the most important things is, as you scale and grow, is taking advantage of those technologies, is not being resistant to change. There's so many things changing in Medicare, right? But I think as as we take advantage of those technologies and reach more people and more, as time goes on, the people who are turning 65, they're more comfortable with those things. And as they're going to Facebook for information versus the newspaper, it's better that we have our Emerald Medicare brand established, so they can get the answers in that place.
Yeah, we've done a lot of great work, and the artificial intelligence. We are really on the cutting edge.
Yeah.
And you've said to me a few times, despite the fact that I'm nowhere near your age, my son is about your age,
Yeah.
Is that I am open.
Yeah.
I am open to the technology advancements. I am
Absolutely.
open to the social media. I'm open to ways in which we can improve our process, become more efficient, handle more clients, get more accurate information. I write a lot of the blogs, but certainly there's benefit in having things edited at some level.
Yeah.
And so we really are trying to take advantage of that as best we can. And
Yeah.
I consider, we talked about it earlier, in these days of America, or maybe the world, there's not enough kindness out there.
Yeah.
And so to us, the kindness that we provide to the clients that we service, I think people feel it and know it, and know that we care. And you've said that a few times.
Yeah, and it sets us apart. One of the things that I kind of talked about it before, was clear to me from day one, was that, our Google reviews, the appreciation that people have for the service that we give them, white glove service, the appreciation they have for our going the extra mile and educating them, it really is unique to Emerald Medicare.
So again, Emerald Medicare is the name of the company. Our website is emeraldmedicare.com. I'm Mark Brownstein. This is Matt Civitano. We have an office in Stony Point and in Nyack, but we really truly service the country. Certainly the core, I say Massachusetts to Maryland is the core, but certainly people move all over the country, and we service them everywhere. Because in some levels, plans are similar nationally. People think that it's very different in different parts of the country, and there are some unique characteristics. For instance, New York is one of the only 4 states in the country where you can actually have an Advantage plan, and in years later, when maybe health issues change, one can change over to the supplement or Medigap plan without any health questions, underwriting, or pre-existing conditions. And that's only the case in 3 other states, Connecticut, Massachusetts, and Maine. So that's a tremendous advantage. So many people will actually start out with the Advantage plans, maybe get a little bit of dental and eyeglass coverage, and maybe some other benefits like even hearing aids. And then maybe years down the road, they're able to switch. And it's a tremendous benefit. And whether that is brought to other states in the future, don't know. All I know is that Connecticut and New York are certainly good places to work because people have that flexibility, and it really does make a difference. But this is the time of the year. So would you say our volume's picked up lately?
Definitely. Phone rings all day, for many hours, 9 to 5. It's ringing during this time of the year with, people seeing, TV commercials or letters in the mail. Like Mark said, their annual notices of change, and they have questions. They want to know if they're on the best plan for their unique needs,
So that is what we're doing now, folks. Those of you who are listening and have friends or neighbors or colleagues that are on Medicare or are looking at Medicare, we're a company who, as you can hear, and you've heard me on the air here at WRCR for years, but we are devoted to our clients. We're devoted to education, and we really are committed to doing what's in your best interest. Mm-hmm. The reason why I work with so many financial planners and CPAs, social workers, and case managers is they do what they do really well. They have the relationship with their clients and their patients, but they need somebody who has the expertise, the confidence in Medicare. Nobody wants to make a mistake. That's one of people's greatest concern, is that they're actually going to make a mistake when they actually sign on to Medicare. There's the dreaded penalty, which rarely comes up in our world because people are in touch with us. They're in touch with us 3 months before they turn 65, 3 months before they retire, or 3 months before they move, because they want information, and they want to know that the next step is in good hands. And people often say, I've heard from all my friends and they've told me this, and I go, let me correct you. on certain aspects of what you shared, and they appreciate. Again, it's confidence that we have, and having had 2,000 clients over the years, we've seen most scenarios. I say we've seen 95% because I'll never go above that, because I do believe that we learn every day, and we have an opportunity to help so many people. And I'll come back to kindness. Kindness, I think, wins the race here, because we really care about our clients to the point where we worry when we're not able to help. We worry sometimes with people who are dealing with tough medical issues and tough prescription drug coverage costs. We take a lot of this personally, and it's that kind of a business that it's not just volume; it's people on the other end of the call. Just if you were to sort of end this time together, which has been a lot of fun, Matt, with just some pearls of wisdom from you and your role at Emerald Medicare, what would you say to the folks here listening today?
Yeah, I would just say I think trust is the most important thing. Everything that Mark just talked about, it just goes to show the trust that our clients have once they talk with us and they see what we're about and they experience the Emerald Medicare helping hand, and that relationship that we really do keep with our clients. It's important to us, making sure that you are taken care of and your Medicare situation is handled and your questions are answered. That is important to us. Even if sometimes, during open enrollment, you might not hear from us right away because of the volume, you're going to hear from us and get the right answers. And we're really going to battle this time of year for you and for our clients. So, thank you so much for having me. This has been a great time.
So, Mark Brownstein, Matt Civitano, Emerald Medicare, 845-358-1220, emeraldmedicare.com. Sign up for our webinar on November 13th. Give us a call. Set up a time to talk to the qualified staff, and have a great weekend. Have a great fall. Halloween is coming, and holidays are around the corner. So I will see you next month. I'll have another guest, and it'll probably be another team member from Emerald Medicare. So thank you all for listening. Have a great day.